Hi, this is Dr. Deborah Kissen, and I am the co-chair of the Public Education Committee for ADAA, and that's the Anxiety and Depression Association of America. And I'm glad to take part in this webinar, Mobile Apps for Depression and Anxiety, Finding an App That Will Work for You. And our presenter is Dr. Stephen Schueller. And as the clinical director of the Light on Anxiety Treatment Center, I have seen many clients that are always looking for good apps and trying different ones out, some more successful than others. So I'm super excited to get some information on an expert on the different apps that are out there and how to find the right app for you. So before we begin this webinar, just to tell you a little bit about the Anxiety and Depression Association of America. It was started in 1979, and today it's the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis, promote prevention, treatment, and the cure of anxiety, depression, and stress-related disorders through education, such as this webinar, our conference that's coming up in San Francisco, and through practice and research. And we're working to end stigma and get the word out that these conditions are real, serious, and most definitely treatable. I also would like to invite you to the ADA website. It's a wonderful resource, and you just go to adaa.org, and you'll also find a great list of treatment providers that are trained in CBT for anxiety and depression and related conditions, and available all over the country and all over the world. And one new feature that the website has that I highly recommend you check out is a free peer-to-peer online support group, where sometimes you just really need a cheerleader in your corner helping you do some things that are hard but good for you. And this is a place where you could find that support. And also, we need your support as well, so feel free to make a charitable donation to ADAA. Presentations such as this free webinar are made possible through those donations. So now we are ready to get started, and I'm very happy to introduce our presenter. Dr. Schueller is a clinical psychologist specializing in developing, deploying, and evaluating technology-based interventions for mental health. He's a member of Northwestern University's Center for Behavioral Intervention Technologies, CBITS, and they have developed a number of technology-based interventions. So let's turn this talk over to Dr. Schueller. And I'm going to do that as soon as, okay. Now we will turn it over.
Fantastic. I think, can you see my screen here?
I can see your screen.
Excellent. So I'll go ahead and get started. So as introduced, my name is Stephen Schueller. I'm an assistant professor at the Center for Behavioral Intervention Technologies at Northwestern University, where we develop a lot of different technology-based interventions, mostly for the treatment of depression and anxiety. And today I'll be talking about, more generally, how people can go find apps that are publicly available in places like the Google Play Store and the Apple iTunes Store, and figure out which apps might be useful for you to be able to help deal with some of the symptoms, the difficulties that you experience in the face of depression and anxiety. So I'll start with a couple of disclosures. I received funding from the National Institute of Mental Health, as well as the One Mind Institute, around the development of and evaluation of different app-based resources. And I'd like to start off with a little bit of the problem statement here, just to give folks an idea for the challenge at really finding a mental health app that will work for you. A recent report actually found there's about 165,000 different health apps that are available on the Google Play and Apple iTunes Store. Now, not all of those are mental health apps. There's a lot of apps for physical health, things for exercise, weight loss, tracking different medical conditions, but a lot of them are related to mental health. And so the estimate for mental health is somewhere between maybe 20 to 40,000 of those apps might be relevant to mental health, depending on how you define that. So there's definitely a lot of apps for depression and anxiety. There's also mental health apps that focus on more issues of kind of general wellness, but might also be useful in the context of depression and anxiety to be able to deal with some of the different symptoms that you're dealing with. So I think that going through all of these different apps that are available on these app stores is a real big challenge. And so one of the goals that I have in this webinar today is not just to tell you what are some of the apps that are out there, but also to give you the tools that when you download an app, when you're using an app, how you can figure out if this is an app that might be helpful and useful for you.
And maybe as if I could kind of pose a question or something to think about as you're giving your presentation, one of the challenges that I think many of my clients experience is when I suggest an app that I think might be a good one for them, they'll say, oh yeah, oh I have that one, and oh I even have this one too, and then they'll show me the 20 different apps that are in their phone, many of which are really good, but beyond downloading the app, purchasing the app, actually using the app seems to be a real challenge, and maybe using it not just for that first moment you download it, but consistently using an app feels like a real challenge in real life clinical settings or for a patient.
And that's definitely something that I think is important towards making people's expectations about what they can get out of these apps appropriate, is that an app is not going to solve all of your problems. Apps are useful tools to the degree in which you're able to use it. And so I think that, for an app to be useful, you have to use it. But there's definitely certain apps that are more or less easy to use, or might have features in there that might remind you to use it, or may fit into your lives a little bit better. And so I think that's also something to consider in the context of these apps. And yeah, we'll talk about that a little bit more. So I think the one thing also to remember in the context of applications is that very few of these apps have been scientifically evaluated. So typically when we think about the practices that we try to do with individuals who are experiencing depression and anxiety, we really want these methods to have gone through sound scientific investigation. So techniques such as cognitive behavioral therapy, acceptance and commitment therapy, mindfulness, meditation, these are all evidence-based techniques for treating and dealing with depression and anxiety. So one of the reasons why there are not a lot of scientifically evaluated apps is because apps are being released very consistently. So as I said, there's tens of thousands of mental health apps out there. It's hard to run a scientific study on all of these. And so one way we've tried to figure out which apps are good and which apps maybe are not as good is a lot of professionals and experts have gone through the apps to try to determine how many of these apps are actually based on sound evidence-based principles that we've established through other scientific studies. And so in the case of depression, there was a study where of 117 apps that were identified, only 12 of those, or about 10%, used evidence-based principles. In the case of anxiety, there were, from a review of 361 apps, only 46 were consistent with evidence-based practices. So again, about 13%. So even though, as I said, there's tens of thousands of apps out there, it's likely that a lot of those apps are not going to be beneficial for you. And so I think that this leads to a really sort of big...
Can I ask you a question, what you were just saying? What is the correlation between evidence-based apps and the number of stars that an app gets, and in terms of how well received by consumers an app is?
Yeah, there's not actually a strong relationship between the star ratings and the evidence base of the applications out there. And so, but on the same token, I think that there's a lot of apps that are out there that have very few reviews. And so reviews are definitely one way to figure out if an app is good. but it's not the only way. And so we'll talk a little bit more about the different ways that you can use information from app stores and other places to figure out which app might be helpful for you a little bit later in the webinar here. Our task really today is in some ways to find the needles in the haystack. That, as I said, if by yourself you're to go to the App Store and put in search terms like depression and anxiety, you're going to get a lot of responses. And so what I'd like to do in the webinar today is talk through a little bit more about how you can actually figure out which apps within those Play stores are good apps for you. So I first want to talk about 3 different ways in which you can think about using apps to help benefit your own mental health. And so I want to talk about unsupported apps, which is using apps as kind of self-help, as standalone practices. So this would be that if you're not currently engaged in any mental health treatment, but you're looking for some sort of resource to help you work through your depression, anxiety. It might be that you're in a place where mental health treatment is hard to get. So definitely I understand in certain rural areas, finding a therapist is not easy. And so mental health apps might be able to provide some resources in that case. It might also be that you are looking for a mental health provider, but you haven't quite found one who you are receiving services from yet. So you might be using these apps as you're waiting to go see a professional. So there's lots of reasons you might be interested in using apps in the absence of other mental health treatment, but so that's one way you might be using this. Another way is what I refer to as supported apps. And so there are a lot of app programs out there right now, and that they're web-based platforms that are kind of associated with them, where the app is provided along with some sort of professional coaching or therapist or some other level professional. And so these apps you're using these apps as kind of the primary treatment, but you have another trained professional kind of helping you progress through the app program. So that's what's called a supported app. And then the last kind of model is what I'd refer to as blended care. And I say blended care because it's a blending of a technology-based treatment with a traditional face-to-face treatment. And so this is when you use apps in the context of traditional face-to-face therapy. So you might be seeing a mental health professional for regular sessions, and I might suggest an app for you that might reinforce some of the things that you're working on, might help promote some of the homework assignments that you're working through, might provide some relief or some support for a particular symptom you're experiencing, sleep, worry, or underline a skill you're learning in treatment, such as meditation or mindfulness. And each of these different ways to use the apps are associated with different benefits and some different barriers or drawbacks. So with unsupported apps, it's definitely less costly to download an app than to see a mental health professional. These types of apps are more available, and you can also use these apps once you have them at any time you want. Anytime you have your phone available to you, you could open up that application and use the tools within it. Also related to that, there's no need then to schedule or talk with a professional, so the scheduling and the time is completely up to you. Some of the drawbacks of unsupported apps, however, is that they're less effective. So research shows that apps that are supported or blended care can be as effective as standard face-to-face treatment, but apps that are unsupported are considerably less effective. So I think that if you are intending to get the same benefit out of a technology-based mental health resource, such as mobile applications, you shouldn't expect to get the same benefit if you're using an app in kind of a self-help or unsupported sort of format. Another issue is that there's less accountability for the app for using those applications. That one of the benefits of going to see a mental health provider is, when you have that appointment on your schedule every week, you go to the appointment, you see your provider. It keeps you accountable to be doing the things you're working on through therapy and through treatment. And with an app, even if there's notifications, even if there's reminders, it's a lot more easy to dismiss a notification or to not open up an application than it is to have to cancel a therapy appointment or not go see your mental health provider. And so, again, apps are useful to the degree in which they're used, And so when there's less accountability, that's another reason why unsupported apps are less effective. Another kind of reason why unsupported apps are less effective is if something comes up in the midst of using that application, if you have a question, if something just doesn't make sense to you, there's no person to call on for some troubleshooting there. And so a lot of times, especially at the beginning of receiving treatment, there's questions you might have about the right way to, to do certain assignments, to do certain skills, to use certain exercises. And sometimes it's really helpful, especially at that beginning stage, to have a professional helping you through that. So that
And,
oh,
yeah, what I would put on the con list also on the unsupported app side is I would think the value of human connection, that knowing that there's someone there who is seeing you and hearing you and understanding you and valuing you. And so, the support, it seems that the supported apps and the blended care has that human connection piece that it seems hard to fully move past mental health challenges without someone on your team.
Definitely. It's always great to have a listening ear. And some of the times I think it's useful to know what one's own sort of support network is like. And so if you have a lot of that sort of support in your network already, and you're really looking for some information and some practice around some of these evidence-based skills that we're talking about, these apps might, unsupported apps might be a reasonable choice to at least get started. But definitely that human touch is not being replaced by a mobile application. So that brings us to supported apps. Supported apps, as I mentioned, are apps that are used in replacement of face-to-face sessions, but where you still have a professional supporting your use of that application. So you get the benefit of not needing to go to face-to-face sessions. This might be really good for scheduling, logistical reasons. I know a lot of people have challenges making it to face-to-face sessions for a variety of reasons. Sometimes professionals are very far away. It's hard to travel that far. Sometimes you might have logistical issues in your life. You're a new mother, you just start a new job. There's all kinds of things that make it challenging to make it to face-to-face appointments. You have someone who's tracking your progress and providing feedback, and I think that's a really kind of key aspect, again, to what a human, brings to this equation when we're using applications, is that it's really easy sometimes to get lost in one's own progression through things. And so to have a sort of an objective outside observer helping us understand how far we're progressing, what we're doing, is really useful. And that a supporter often knows the app very well. So definitely when we have these supported apps that are programmed, that is the app in conjunction with the professional knows the ins and outs of that application. They've used the tools, they know the different features, they really know how to guide you through that application. Some of the cons is that there are fewer available. There's not a lot of supported apps in this way that I'm talking about it on the market. The expertise of the supporter varies. Some apps use licensed clinical psychologists. Other ones use lower level paraprofessionals or professionals. And so I think that one key is, if you're going to use a supported app program, to really understand who those supporters are and what their expertise is and what they're able to provide for you through the context of that supported app. And often supported apps have this support as a premium feature. So even if the app itself might be free or low cost, the support often is more costly. And so you might start using an app and not realize that it was intended to be used in this kind of supported way. And so that cost is something you're going to have to consider when you decide if the support is something that you need. The last kind of way to use an app is as I refer to as blended care. Again, you're seeing a professional for standard sort of face-to-face traditional treatment, and you're using these apps as more kind of add-ons or adjuncts. So some of the pros is that you have that trained professional there for safety and security. If something comes up, you have that professional who knows how to really take care of it. definitely in depression, anxiety, issues of suicidality and safety and things like this. I understand that coping with depression, anxiety, can be really challenging sometimes, and definitely having an expert who knows how to deal with some of the specific challenges that come up in the face of depression, anxiety is really, really beneficial. You get accountability through regular appointments. And accountability is really important to helping people achieve their goals. And so having that sort of regular time to check back in with a professional and see how your progress is going really is beneficial to be able to keep up and use those apps. It also might increase the benefit or the efficiency of treatment. So using a mobile app while being in therapy might help you be able to review the lessons that you learn in therapy more often. There's definitely some apps that reinforce different homework assignments. So for example, there's PTSD Coach and PE Coach from the National Institute of Telehealth, which supports exposure treatments for post-traumatic stress disorder. And they have a lot of tools in there to help you work on the homework assignments that might come up in the context of that therapy. And so sometimes if you have the app, it really might help you move through that treatment more quickly than you might if you don't have the application. Some of the cons, again, it requires access to face-to-face treatment. I understand that there's a lot of places where people just don't have access to trained mental health professionals. And I know that one of the kind of promises of technology-based interventions is to make treatment available to more people. So blended care, you still need a professional that you can see. Apps often have limited interoperability. And so what I mean by that is that a lot of apps don't have good ways to feed information back to your provider. And so if you're using an application while in treatment, you really want to be able to share some of that information with your provider. And sometimes to do so, you might have to open up the app in session and show it to them yourselves, as opposed to having simple ways to kind of email or print out or share information with your provider directly from the application. And then the last real difficulty I see is that providers might not know the app. And so I think that's a limitation, both in terms of a lot of providers might not know good apps to refer you to. And if you're using an app and it's not an app that a provider is familiar with, there might be features or aspects of that application that they're not able to help you with. So I'll pause right there for a second just to check in to see if you have any other thoughts or questions before moving on to going through a little bit more detail about, now that we know about the different ways in which you might use an app, how do you actually go about finding an app that might work for you?
I did have a question about, I think, can you go back to the slide before, if it was called supported or, yeah, on the supported apps side, I've seen and heard of different apps where they have, I think they call them therapists, online therapists that go, that support the use of the app. And I was just wondering, on a legal level, uh, can one provide therapy across state lines, and
Yeah,
how
so
does
I
that work?
most of
Yeah.
the programs that I know that are doing this, and I know a couple, so things like Ginger.io, Joyable, Lantern, um, if they're providing, if they have a therapist who's presenting themselves as a therapist, they have to be licensed in the state in which they're providing the treatment for. So a
Oh,
lot of these programs actually do have licensed therapists who are licensed in multiple states. And so that's how they're able to provide treatment to people in different states. So you um, would not have a therapist providing therapy to you across state lines.
got
That
it.
being said, there definitely are some programs that use coaches or health coaches or other sort of uh, paraprofessionals. And so I think that pay attention to the terms that people are using for what they're providing. And then also, if you do engage in any of these supported programs, make sure as much as possible that you read and try to understand the terms of services so you understand what is that service that's being provided to you. I know this is a really challenging thing sometimes for consumers to understand and to appreciate, but I think as much as you can try to be educated about what it is that you're receiving, the more empowered you'll be to be able to make the best use of it.
Yeah, for example, I just spoke with a client who thought he was signing up for a $30 a month text package, and then I think one of the therapists had emailed him, and maybe he emailed back. He ended up getting a bill for 120. So the fine prints of knowing maybe the package he originally signed up for, and then he ended up using more services, and he didn't realize that ended up upping the package that he was then signed up for. So yeah, I think that makes a lot of sense what you're saying of just really paying attention to what services you're signing up for.
Yeah, and I know, I mean, I download a lot of apps myself. I'm very into this stuff. Often I'll see a term of services agreement. They're very long, and I'll click OK even without reading it. I understand that. But I do think that in the case of your mental health and when we're talking about health treatment, to read those agreements more closely than you might when you download a different application.
Yes, that's a good point. Oh, and one last question on this front. Do you know if any insurance plans are currently covering web-based supported app therapy?
I don't know of any insurance plans specifically that are covering them. I do know in some different insurance systems, so Kaiser, for example, I think Group Health as well, they're piloting some of these models of teletherapy and sort of internet-supported therapy and other sort of creative ways to use technology for different behavioral health services. And I think within some of those systems, there are services that are offered as part of the coverage you receive.
Okay, sounds good.
Yeah, I think definitely if this is something you're interested in and you do have health coverage, it might be worth, contacting your insurance provider to see if there are different web or mobile-based treatments that they have for behavioral health. It's becoming more common, and so I think within the next couple years here, we'll see this a lot more prevalent through a lot of different insurance providers. Great, so I'll jump in to talk a little bit about how to find an app. And so I'm really going to present a multi-armed strategy here because I think that really one of the lessons that I want to promote here is that there's not one app to rule them all. There's not an app that's going to work for everybody. And so I'm going to go over some different ways you might go about finding an app, but also remember that you can use different strategies. There might be a couple different apps. I really like the example that you used kind of as we started, that some of your clients that you work with have a couple different apps that they're using, and I think that that might be the case, that there could be a couple different apps that might work for for each person to help really provide the sort of like best support that they need. But I definitely think there's probably a limit also that 3 apps might be good, but 20 apps might be too many when you're really trying to focus on some of these different things. So the first advice I would have is really to seek expert opinions. I think the first line of defense in terms of finding an application would be, if you see a therapist, ask your therapist. And I think many therapists are getting more savvy about the mental health apps that are out there. I definitely try to stay more in touch with people in the clinical community to advise and to give guidance in terms of what different apps might be out there and what apps might work for them. If you don't see a therapist, find experts. So I think that a lot of mental health professionals who are really engaged in the technology space have recommendations of apps that they might use. Look for apps that are associated with people who are are well-respected kind of treatment providers. Associated with universities is often a very beneficial way to find good apps. As I said, the National Institute for Telehealth at the Palo Alto VA has a lot of apps that they've developed, and I'll have a link for their apps a little bit later in the webinar today. But also look for particular recommendations for particular problems. And so by that I mean, don't ask experts or your therapist for, what's an app that you like. Talk about the different things that you're going through, the symptoms that you have. Are you having sleep difficulties? Are you dealing with a lot of worry? The different treatment strategies you really like. Do you really like cognitive behavioral therapy and different skills or exercises like cognitive restructuring? Do you really need some help and support around figuring out more positive activities to do to enrich your life? Does mindfulness and relaxation work really well for you? So the more specific you can be about what it is you're looking for, the better recommendations that you can receive from these experts. Along the same lines of consulting with experts, you can also look for what I call app clearinghouses. And so by what an app clearinghouse is, I mean by that is that it's a place to find apps that is more narrow than the Google Play Store or the Apple iTunes Store. So definitely you could start your search by going to these stores and putting in things like depression, anxiety, worry, sleep difficulties, motivational problems. But different places on the web, experts have done that work for you. And so two app clearinghouses I'd like to point out. One is associated with ADAA. And so there's actually a section on the ADAA website where volunteer reviewers, mental health professionals, have gone through different mobile applications. They've come up with a rating system that tells you the evidence behind these apps, which ones seem to work well, some of the usability, the user experience of those applications. And so if you want to find those apps, it's available here on the ADAA website, adaa.org/findinghelp/mobile apps. There's another app clearinghouse that I'm actually affiliated with, which is cyberguide.org. Cyberguide is a website that has product reviews around different mobile applications. So on the ADA website, there's about 10 different mobile apps that have been reviewed right now. CyberGuide has about 80 mobile applications up there. And on the CyberGuide website, they're sortable by different conditions as well as by different treatment strategies. So you can look at just the apps for depression, for example, just the apps for anxiety, just the apps that use cognitive behavioral therapy. And each app will have at least 2 ratings on it, one from the CyberGuide website and one using another rating scale. And some of these apps even have expert reviews associated with them that you can click on, which will give you more information about that application. So again, if you're looking for mental health apps specifically, sometimes it's really useful, instead of going straight to the Play stores, to start with a more consolidated app clearinghouse like the ADAA website or CyberGuide. So just to give you a little example of what the information you might see on those different app clearinghouses, you see on this slide first the rating key from the ADA website. So each of those apps will review the ease of use, the effectiveness of that application, how much personalization is available. So how easy is it for you to take that app and make it useful for you particularly, how much interactive feedback is in that app, and how much research and evidence support is behind it. And CyberGuide has a very similar sort of rating system. It looks at the amount of research evidence behind it, how specific that proposed intervention is for the particular issue it's supposed to deal with, the number of consumer ratings are out there, and the support behind it. So those are just 2 different ways that those resources are rating applications for your information. You can think about both of these resources as sort of like a consumer report for mobile applications for mental health. So what about if you did want to go directly to the app stores? How can you actually find the best apps on those app stores? One of the things that I would really recommend you do is, in addition to searching for either depression or anxiety, to think about the symptoms you typically experience. So like I said, things like sleep, worry, different things that are common in depression and anxiety. What are the symptoms that are most prevalent to you? Because if there's a symptom that's really slipping you up or catching you up or really contributing to some of the distress you're experiencing, it might be most useful to pick an app that works specifically with that symptom. Another approach is to try to find an app that helps you do the things that you know are helpful for you. So things such as exercise or goal setting. There's a lot of apps, a lot of these features are present in the different apps for depression and anxiety. But if you start with those search terms and look for those apps as opposed to starting with the more broad search terms of depression and anxiety, you're more likely to find kind of the narrow apps that will work for you. And then also, I think it's useful to learn how to read reviews. So when you read a review, it's useful not just to look at the multiple star ratings to see how what the rating is for that application, but also to see what people like and what people don't like, and to see if those things are things that might be common for something that you might be going through. A question, that I think comes up a lot is how many reviews should a good app have? And I think that it's a tricky question to answer. I think that usually I might expect somewhere in the realm of 500 to 1,000 ratings for an app that's been out there for a while and has been pretty popular. But if an app's a new app, it's not going to have that many ratings. So actually on the next slide here, I have some examples of different ratings, both from the Google Play Store as well as from the Apple iTunes Store. So first, let's look at the Google Play Store one. A couple things I'd like to point out. So we see that this app has a 3.7 average out of 5, which is pretty good. Most people give it either a 4 or 5-star review, which is something I think you really want to look for. So I think somewhere within the high 3s on a 5-star rating scale is where you want these applications to be in terms of application quality. The other thing I'd like to point out is you can see on the Android store here, under additional information, it has when this app was updated. So you can see that this app that I'm looking at here, Mindshift, was updated fairly recently, February of 2017. The more often or the more recently apps are updated, I would say the better it will be for you. That a lot of apps people will put up on the App Store and they'll never update it. And I think that shows just the level of care and dedication that's given to this application. We can also see here that this app has between 100,000 and 500,000 downloads. So that's really, really positive. I think that usually you want to see an app have at least 10,000 downloads, again, assuming it's an app that's been out there for a while, because that shows that it's really been taken up by the population and that people really find it useful and helpful. Again, shifting over now to the iTunes Store, a lot of the same information is here. So we can see the average rating. This app has a 4.5 stars with 1,300 ratings. So this is a good star ratings based on a good number of people using the apps. Most people are extremely positive about this app. They give it 5-star reviews. We look down at, this is a rating for Pacifica, which is an app that has a lot of different tools for mental health within the application. We can see that this app was updated February 24th, 2017. So again, a very recent update from this application shows that the Pacifica team is really investing time and resources in terms of making sure that the app is being updated and that the functionality bugs are worked out, that new tools are added. And so that's something again that you want to see, that the longer it's been since an app's been updated, the more likely it is that that app's going to have bugs or other sort of problems that get in the way of it being useful. I think another useful thing to do is to ask other people who use apps. So this was something actually we were chatting about just before the webinar started, is how do you find, when you're working with clients, how do you actually find apps to recommend to them? And one way is if a client comes to you with an app that's useful and you talk with them, they have a really good experience, that might be an app that we as mental health providers might recommend to other ones of our clients. So if you're looking for an app, post on social media. If you're in kind of support groups online or other sort of places where you get information or support from people who are experiencing depression, anxiety like yourself, you might ask them if they find apps that are helpful for them. And I would say not just ask, what they found helpful, but why they found it helpful and what is it that they get most out of it. You might post on listservs, app marketplaces. You might be able to find ways to be able to post questions for people. But also remember that just because something worked for someone else doesn't mean it will work for you. So again, I think that this still is a process of sort of trial and error as you work through these different applications. If you're engaged on the internet, which I think many people who are probably watching this webinar are interested in mobile applications for anxiety and depression, probably have spent time on the internet and have a strong interest in technology, you'll often find top 10, top 8, top 5 lists of mobile applications. And so I think those are good places to start to find apps. And usually I see a lot of the same apps talked about on a lot of these lists, apps like Headspace, apps like Pacifica, different apps that are out there that have been used a lot tend to be the ones that show up. And so I think this is a good place to find some of those apps that are kind of widely accepted as useful apps for depression and anxiety. And then lastly, I think after you've done all of these steps, you've found the app, put it on your phone and test it out yourself. So I think that, when I say pilot the app, I mean, really try in that first week when you have that app to use it a lot, to go through the different features, to figure out like what the app can do. Does it have notifications? Does it have different tools? Does it have videos in there for you? But also look for some specific aspects related to that application. So again, I think one thing to really appreciate here is to read those terms of services when you download an app. Does the app have a privacy policy? Is it collecting data? And if it is collecting data, what is it doing with that data? There's definitely a lot of apps out there that collect data that then send it back to the developers of that application to use. And so I think that you need to try to be aware of, if they're collecting data from you, how is that data being used? What are the security measures on the application? Does it have a PIN code or a password to jump into the application? If not, I really recommend that you put a PIN code or password on your mobile phone device, and to make that password a secure one if possible. So for example, on iPhone devices, you can choose to have a 4-digit or a 6-digit PIN code. The 6-digit PIN code is much more secure, and it's not much more challenging to memorize a 6-digit number than a 4-digit number. So I would really encourage you to put those security measures in place on your phone, but also just look at the security measures that these apps have. Is the app useful? So what does the app say it can do? What are the developers, what are the expectations they have for what you should get out of using this application? And how will you know if it works? So if they're promising certain things, what way do you actually know if they're fulfilling their promises? And so sometimes it can be as simple as, if it's an app that's supposed to reduce your depression and anxiety, do you have a way of kind of tracking how you're feeling? Maybe you can just write on your calendar when you started using the app what some of the symptoms you have and how intense they are. And then after a week, you can kind of check back in on that. But you should really do a little bit of review of, is this app actually useful for you? Is the app easy to use? Even a really useful app, if it's a real pain in the butt to use, is probably not going to mean you're going to use it for the long term. And so again, as I said earlier, one of the apps that are used are ones that are going to end up being effective. And so if you're not able to use that app in a long-term sort of way, it's likely not going to give you a lot of benefit, a sustained benefit from using an application. Along those lines, I think customizability of an application is really important. Can you personalize it? Can you adjust features? If there's features you really like, are there ways to kind of note that and then be able to go back and to use those features more often? So the customizability of the app is really important for the ease of use. And then lastly, can you share information? This relates to the interoperability, which I mentioned. So can you print, export, or share data with other people? Again, I don't think that people always want to be able to do this. I'm not suggesting that you should always be sharing information, but definitely if you want to share information with a provider, with a family member, with a peer, it's often beneficial to have the ability to do that, and some apps give you the freedom to have more control over your information, your data. So I want to spend the last little bit of our webinar just talking about a couple apps that are out there, because I think that, as I said, there's a lot of apps, and I definitely am not going to endorse one particular app as being the best app or the app that's going to work for you, but I think that a lot of people coming to this webinar are going to want to look for different mobile applications, and so I want to give you some ideas of the apps that are out there, but then also review with you a little bit of, as I look through these applications, what I'm looking for when I look at a mobile application to decide how useful or how good it is for people who are dealing with depression and anxiety. So I want to just start with a sort of example that I will say I'm completely biased about in terms of full disclosure. So this is the IntelliCare app suite that's actually been developed here at Northwestern University as part of the Center for Behavioral Intervention Technologies. And I've been one of the team members working on the development of these IntelliCare apps. So what IntelliCare is it's actually a suite of different mobile applications. We have 13 apps that are actually part of the IntelliCare suite. And each app focuses on a specific behavior change strategy that's evidence-based to be able to deal with depression and anxiety. So for example, we have a sleep hygiene app called Slumber Time that helps teach people positive practices around creating a beneficial kind of sleep routine. We have an app called Thought Challenger that helps people examine and reframe their negative thinking patterns. We have an app called My Mantra, which helps people stay in tune with their goals and some of their values. And so in IntelliCare, there's a lot of different applications. And one of, again, the benefits and the ideas behind IntelliCare is that no app is going to work for all people. And so we want to find an app that is kind of most useful or most beneficial for you. Another kind of idea behind IntelliCare is that these apps are meant to be very lean. And so they're apps that you can use for maybe a minute or 5 minutes at a time, a couple times a day, but really as needed. So to check in with a skill or with a strategy to be able to use it when you need to do it.
Are these apps available? I just pulled it up, the App Store from my Apple phone, and I don't see IntelliCare.
Yep, that's a good point. So IntelliCare is only available on the Google Play Store, and so definitely as at the time being, we're working on creating iOS versions right now. But for each of the apps, as I go through this next couple section, I do have on the slide which App Store it's available on. And so if it's available on both iTunes and Google Play, I'll have both the Apple Store and the Google Play icon on the slide.
Ah, okay. So Google Play means it's for Android, and App Store is for Apple phones.
Exactly.
Is that okay? Got it.
So great. Yeah. So we'll move on. So this is an example of Mood Tools. It's a very popular app that's available on both Android on Google Play and iOS on the App Store. What I have here is just a picture, some screenshots of a couple aspects of the app. So the first screen you see here is just the home screen as you open up the app. You can see that it's a little sparse in terms of the way it looks, but I think that's good because that lets you see exactly what information, what stuff is available in this application. So we see that it has information, which is just general information about depression. It has a test which allows you to track your symptoms. Again, I said symptom tracking is really important to try to figure out if you're getting benefit from the application. So to see symptom tracking within there is really good. It has a thought diary, which is an evidence-based strategy around challenging negative thoughts that you might experience. It also has a set of different videos. So I show here an example of the thought diary. Again, I think this is great because I know this is an evidence-based practice. I know, at least through some of the clients that I've worked with, that working through a thought record like this can be challenging at first. And so when I see this as a user, it makes me a little worried that this information is a lot of information to kind of digest if you're just working through this in a self-help sort of way. So it might be that a tool like Mood Tools here could be really good in sort of a supported or a blended care sort of way. If you're in treatment and you're doing a lot of work around cognitive restructuring and using thought records, it might be more useful to have those things on your phone as opposed to printing out paper copies, or to figure out other ways to just keep track of them in like a notepad or something like that. But again, this might be a hard thing to understand if you're trying to do this in an unsupported or a self-guided sort of way. The videos, on the other hand, this last sort of screenshot here, is a really nice way to be able to have a lot of different strategies, a lot of different skills that are helpful for you. So the video section might be a good place to kind of start if you're using this Mood Tools in an unsupported way or a self-guided sort of way. Some of the things that I think that we don't see here in the Mood Tools is we don't see a way to really kind of customize this, to pull out the videos, to rank the videos that are most helpful for you. And so one of the things that I'd love, to see in this in kind of long-term use is better ways around customizability. So again, I look at this app and I see some good stuff in here. I also see some stuff that I think could be better if I was trying to be able to use this in different sort of formats.
Question, is this in terms of sending the entries to a therapist? How is this one in terms of exporting the information?
So I think Mood Tools, at least the basic version, does not have an ability to export this information. So if you're going to want to share your thought diary with your therapist, you'd have to open up the app in the session and show it to them. So again, I think that's a place where a lot of these apps have challenges around the interoperability or the way to kind of share information with people you're receiving treatment from.
Okay.
The next example I want to give is one called PTSD Coach. PTSD Coach is one of the first mobile apps developed for mental health, developed by the National Center for Telehealth at the Palo Alto VA. It's available on both Google Play and on Android and on the iOS store, on the App Store. There's a lot of stuff I really like. I'm showing the Android version of this one because I showed a Apple version of the last app. So this is the Android version of PTSD Coach. I like the fact that there's a lot of different information here. So if you click on that Learn button from the home screen, it'll open up this center picture here, which gives you information about PTSD. What is treatment? How does it work? How do I find someone? So if you were to download this app before you saw a professional, PTSD Coach could actually give you a lot of information that would help you find a professional. This last picture here on the right-hand side is one of the, from the Get Support menu. It just is a skill or a strategy it provides you in terms of grounding. So this strategy says, suck on a peppermint, slowly suck on a mint, and describe the taste and your reaction in detail to yourself. I read this and I'm like, well, you know, peppermint's not a particularly thing that I'm interested in. Maybe this wouldn't be the best strategy for me. It's great that you can click refresh and it will give you a new tip. So it'll give you a new way to ground yourself. What's also cool in terms of customizability is you can click thumbs up or thumbs down in terms of if you like this strategy. What's unfortunate though is that thumbs up or thumbs down personalizes or customizes this application using that grounding strategy as a whole. So if you click thumbs down, you won't be suggested grounding later on. So it could be that grounding would work really well for me, but not this particular way to ground myself. And so again, this app is nice because of the customizability, but not as nice in terms of having a lot of different techniques in here and having to sort through things that maybe aren't the best kind of strategies that will work for yourself. The last example I want to show here of an application is an app called Coco. It's available on iOS on the Apple iTunes Store. It's also available through different messaging platforms, so Facebook Messenger, through Kik, through Tumblr. And so you can also access Coco not using a mobile application at all, but through some of the different messaging platforms you use. If you use Facebook Messenger on your computer, you can then access Coco that way without even having to go to your smartphone. What Coco does is it's a very simple application that you put in a experience that you're going through, a situation, and a thought that's associated with that situation. So here's an example. I lost count on how many times he stood me up, about 90% of the time. I feel worthless because I think he doesn't love me and I just disappear without a word. Then 6 months later, he pops back and I just get back to the same situation. So you put into the Coco app something that you're struggling with, and people on the other side will help come up with a positive reframe and emotional and social support around the different situation. You can also look at other people's struggles and provide support to them. And so it's also a community where you can find kind of validation and for some of the things you're going through as well. And when you put in this information into the Coco app, when you put in the situations, you'll actually get notifications when people come up with reframes or emotional support for you. So I think Coco is very nice in that it's a community around a very specific behavior change technique, this cognitive restructuring thing that we do, and a lot of cognitive behavioral therapy. It integrates with a lot of different platforms. It's engaging because people will reach back out to you, and there's content that's created specifically for you. When you put in a negative thought to the platform, you'll get a customized, personalized reframe back. But there's not as many different tools within this platform as some of the other applications that I mentioned or I talked about.
A question about this one, is it moderated in any way that do people tend to only provide positive reframes? I guess I would just hate for someone to take a chance with this and then somehow gets trolled or something negative gets gets responded to them.
Yeah, Coco is moderated both through automated and also human moderation. So automated moderation means that responses get passed through a computer algorithm that scans them for any sort of trolling or information. And then also humans review the information before it gets sent back to you. So there is moderation that goes on
Good.
to make sure that people won't be trolled, because I think all of us have probably had experiences where we posted on a social platform and had people post comments or post remarks that are not the most positive things. So in conclusion, I just want to have a couple more sort of points here. When do I know if an app isn't enough? Like, when is it that I need to go somewhere beyond the application? And so I think there's three areas where I'd really point you to needing some additional support. One is that if your symptoms are getting worse, and so if you started using an application, a mobile app, and you're experiencing certain symptoms of depression and anxiety, and it really seems like those symptoms aren't going away and you're actually getting worse, that's a good time to then contact a mental health professional and to find additional support. Another one is if you're really having trouble keeping up with the app, that you just find that you're not logging in and you're not staying consistent. Again, these tools are useful to the extent in which you use them. And so if motivation and or other sort of difficulties are getting in the way of you using the mobile app, that might be another time to reach out or try to find a higher level of support, possibly by searching for a therapist or another professional who can help you. And then if you were using that app and you were using an app and you were finding it helpful for you, it might be a good opportunity to start with that provider, to talk with them about the app and what you learned from it and how it was useful, to give them a little bit context of what it is that you've been trying for the different issues that you're facing. And then lastly, if you feel overwhelmed by the recommendations the app is making, or you don't understand some, and so you have this app, there seem to be some good stuff and you just can't make sense of it anymore, that's another good time to kind of follow up with a professional. So, in summary, there's lots of mental health apps that are out there. Few have been vetted, though, either by research or through other people. And so I think that really that I would encourage some degree of caution when you go to these mobile applications, that unless you have some evidence that it's useful or beneficial through some of the different sources that we talked about, experts, app store reviews, clearinghouses, to tread carefully and to really try to evaluate the claims that it's making. Apps are just one resource available for mental health treatment. They're not the only one. And I think, really to make sure you consider these in the context of traditional face-to-face treatment as well. And even good apps won't work for everyone. So make sure that you find an app that will meet your needs, what you're dealing with, what you're coping with, what you're going through. Again, I want to make sure that I have some examples of apps, because I think that this webinar would not be, I know a lot of people are looking for this webinar to figure out what are some of the apps I should start with, Stephen? Where are the first places to look? And so here are a couple apps that are popular and I think are well used in the areas of depression, anxiety generally, and then also a couple apps around sleep. And again, also the National Center for Telehealth and Technology through the VA has developed a lot of different mobile applications. And here's the link where you can get all the different apps that they've developed. And so that's it. That's everything I have for today's webinar. I would really encourage folks, if you like this webinar, if you have feedback or you have additional questions, my email is available here. Feel free to send me an email. I love to hear from people who are using apps and what they find useful and what they find beneficial. And also you can follow me on Twitter at Steve Schueller.
Well, thank you so much, Dr. Schueller, and thank you to all that are currently viewing this webinar, and feel free to email your questions to Dr. Schueller at the email address that he mentioned, and also you can write us directly at ADAA at webinars@adaa.org. And We look forward to offering you future programs, so keep a lookout for future ADA webinars, and until then, take care, and hopefully we'll connect with you soon. Thank you so much.